name is Elizabeth Krieger, and I'm going to be a pediatric bone marrow transplant physician when I complete my training. I like to joke with my family that I'm currently in the 27th grade, or fourth year and final year, as I've promised my wonderful husband, of pediatric hematology and oncology fellowship. This is an additional year on top of the typical three, where I am further honing my bone marrow transplant and cellular therapy skills. My training has been a long and winding journey, like many in the healthcare field. I'm originally from upstate New York, and my first job after college was in Albany, New York, as a pediatric hem-onc nurse's aide. This was where my friend Lauren was treated for leukemia when we were in the second grade, and then again when she relapsed several years later. Lauren passed away right before we started sixth grade. Her death to my sixth grade heart was abrupt and confusing. 1 month before her death, we were running around playing and climbing trees, and then she was gone. I felt helpless. This job was where I fell in love with pediatric hem-onc and that patient population. I vowed also to never feel that type of helplessness again. I then moved to a small West Indies island of Dominica to study medicine, and then Saginaw, Michigan, Syracuse, New York, Richmond, VA, and finally, I uprooted my family one last time to Minneapolis, Minnesota for my final year of training. The constant moving is draining financially on top of all of our mounds of medical school debt, but more importantly, socially and emotionally, especially this last move as it takes us 20 hours from all of our friends and family. But I'm lucky to have a family and a husband who are willing to make it work no matter the distance. The majority of my time at the university is spent on the floor, taking care of patients or in clinic, seeing patients in follow-up and new consultations. It's draining and it's long, continually making decisions on some of the most complex pediatric patients in the hospital. Part of my training, however, centers around research and how we can best treat children's cancer and genetic conditions better. While I love and am passionate about the clinical work that I do, research is where I can have the most impact and the largest ripple in the world. But this spark does not make embarking on a new career easy. Most open positions for young clinicians do not contain protected time for research, and you have to buy down your time with grants. However, you need experience and research to get grants. It can be a vicious cycle, and new small investigators can get swept up in it. But it is my dream to move medicine forward. Over the past several decades, transplant has improved greatly, and overall survival is much better. However, due to the complex system at hand, we look for small improvements through statistical outcomes, making outcomes like disease relapse stochastically determined, meaning when I sit down with a family, I can't tell them who's going to relapse and who's not going to. This is a continued point of frustration for our families and the whole entire team. To that end, the best piece of advice I've ever received during my training was to think like Newton, not like Darwin. While Darwin and his logic are important, detailed analysis, looser causality, which lead to outcomes that are not mathematically described or predictable, there are already many in medicine who fill this space. My goal over the next 5, 10, 15 years is to learn better how to think like Newton, examining fixed interactions that can be described with logical causal equations. Over my career, I plan to examine the immune system as a whole, with its communicating parts, not silos, as it's traditionally studied. I am driven to connect the innate and the adaptive immune system, to utilize them both to treat cancer with less toxicity. I am driven to close the gap so that when I or any physician sits down to discuss a new diagnosis with parents, as their worlds are already inherently falling apart around them, we can be more informed of the potential outcomes at hand. I'd like to thank you, FIGS, for this wonderful opportunity, and remember, everyone, we can do hard things.